Welcome everybody to this is if you're in the right place, this is the Health Policy MSc for Imperial open evening hour, and the idea is for us to introduce the Health Policy MSc course so that you can meet some of the team who you might want to speak to again after this time, to ask any questions that you might want to ask, and hopefully have a much better idea of what the course involves and whether or not how much you want to do it by the end. I mean, I presume you're going to definitely want to do it. It's just a matter of how much we can convince you want to do it. So my name is Colin Bicknell. I am the course director for the Health Policy MSc, under, of course, Aradazi. And I've got with me here Melanie, who can introduce herself.
Hi everyone, I'm Melanie Perkins. I'm the course administrator for Health Policy, so I look after the students once they're enrolled on the course.
And Jason.
Yeah, thank you, Colin. Hello everyone, I'm Jason Murray. I'm the head of programs for Health Policy and also our patient safety program run here at the IGHI. So I work closely with Colin Bicknell and Mel Perkins on the delivery and the strategic planning for the program.
Excellent. So I will start off then with a rundown of the course, what it involves, where the course sits within Imperial, and what doing the course entails. It's designed to feed you information to ask questions about. So do shout if you need anything. I'm not sure I'm going to be able to see your hand while I've got the screen on presentation. So if I ignore you, you either need to shout out or wait to the end, I think. The host has disabled participant screen sharing, which means even though that button was green, I still can't share.
You should be able to now. Sorry, Colin.
No, don't worry. That one, I think, is. Can you? I think you can see my screen now.
We can, yeah.
And I can't see anyone. So, the MSc in Health Policy at Imperial. Welcome. We just did program overview and open questions. So we've got half an hour for questions, I think. Oh no.
Apologies, just to note, Colin, right. That's supposed to mean 4 o'clock to 4:30, and then questions at 4:30.
We're on French. The Health Policy MSc obviously is part of Imperial. We are very proud of Imperial. There are a number of different rankings that you can use, and you can pick out whichever ones you like, of course, but pretty consistently Imperial comes within the first 3 or the top 10 in the world, in Europe and in the world, and ranks very highly in technology, science, and now some of the policy aspects. We did exceptionally well in the research exercise framework and came top with a greater proportion of world-leading researcher than any other UK university. But the thing you're really interested in is this, which is hidden away on the right-hand side, that it's first in the UK for graduate prospects. And actually, the last time it was measured, Imperial students earned more per head when they came out of university than anyone else in the country. So you're in the right place. Within Imperial, which is made up of a number of different faculties and departments, there are some special institutes, and one of them is the Institute of Global Health Innovation, which is run by Professor Darzi, who leads not only the Centre for Health Policy, which is really where this Health Policy MSc sits, but also there's a Centre for Robotics and digestive health and on all these other centres that look at global health innovation. It's an exceptionally successful partnership of innovation topics. But within that, the Centre for Health Policy was designed a good 10 or 15 years ago, really to produce the data, to produce the research needed to be able to create and implement and sustain health policy, not only in the UK and the NHS, but around the world. And as a spin-off from that creation of the Centre for Health Policy, the Health Policy MSc is designed to educate me and the others in our journey along the way. We have had 570 people start the course over the last 12 years. Of those, 425 have graduated, over 120 are still on the course. That's where the others are. We have a very good record of getting lots and lots of people through the course. And we are very proud of our alumni who go on to often progress up the ladder of health policy around the world, often jump from their jobs into industry and start some very good industry and innovative sort of companies, which is great, and often jump from the NHS or elsewhere to research. And we have a number of our graduated students here up in our department, which they've stayed very close to their research aims. So the aim is to get you very interested in research, but also make that make all that knowledge and skills that you have very relevant to your work and future career. So we offer the following qualifications in health policy. You can do a one-year program, which is basically the 4 modules. So actually, overall, there are 8 modules, and then there's a 9th module, which is the dissertation. If you do 1 year, you do 4 modules, and you will get a certificate if you pass them all. And you can do the first year as a certificate or the second year as a certificate. And I can't for the life of me remember what we ended up calling them, but you can see what they involve later on. You can do a 2-year part-time program. The diploma in health policy is the 8 core modules. The MSc is those 8 core modules and the research project, the dissertation on the end. That all of these are part-time. We do not offer a full-time MSc in policy at the moment. So the program format, it starts sometime in September, October with an introductory day where we're basically getting everyone to network and introduce each other and meet all of the many of the course team that we can get along, as many as the module leads that we can get along, and mainly your fellow students. And we try and get all of the induction done and the badges and all the boring stuff at the same time, whilst having a good meet. And it works well doing it that way, because it does mean people can meet before we get online for the majority of it. We have 8 modules, 4 in the first year and 4 in the second year, and that is a mix of teaching and online activities with a good deal of personal study and some in-person 3 days at a time. I can't remember what I'm trying to say with the in-person days.
Workshops.
So blended course. Workshops. It's a blended course. Workshops. Each of the modules is assessed with 2 or 3 weighted assessments. We've overhauled those assessments in the last 2 or 3 years to become more and more authentic, is the word, to relate more and more to everybody's day-to-day life and day-to-day jobs, and be more useful to people, assessing real life skills. We used to do 8 3,000-word essays, which, whilst they are brilliant at testing your essay writing skills and some of the deep academic knowledge, it wasn't right for everyone. That the dissertation, for those who are doing the MSc, is basically an education in research. I can't put this any better. And it is a chance to to look at different methodologies to try and study the situation and improvement, and to look at how you might go on to test or improve the situation in your chosen field. There's training in many research techniques that goes on, and then hopefully awarded the certificate, diploma, or MSc. The structure, this is it in a slightly different way, in that term one is 2 modules, term 2 is 2 modules, and the dissertation is the whole year, this whole second year, starting in August of the, I don't know whether I think that's the end of term 2, beginning of term 3, in that hiatus there. And the program is structured so that we start off really broad, looking at health systems and policy throughout the world, talking about the way that different health systems are made up and the way that different policies are made up. We also do a very good introduction to examining and studying the literature in that module. We're then looking at economics. It's economics and behavioral science and behavioral economics. There's a module on financing healthcare. So there's 2 economic modules, not just in the UK, but around the world, using lots and lots of examples. We look at health and society at the end of the first year. We look at innovation in healthcare, which I think is a really important part of health policy. It's not just innovation in terms of the lovely shiny robots that we all like. It's also innovation in the way that we do things, and frugal innovations and design innovations and every other innovation you can think of. We then start to look a bit more then at individual systems and individual institutions and individual teams. We're looking at measuring and improving performance in healthcare at the system level, institution level, and also at the level of each individual patient. And we look at and that's a choice whether you do that module or you do communicating health policy, where we look at how you might communicate about a certain health policy to ministers, the general public, the teams, the individual patients. We go even more specifically looking at health service delivery, how that health policy comes down to the individual wards, teams, individual patients on the wards at the end of term 4. And lastly, we look at leadership. That's leadership skills that you will be able to learn and use, but also some of the theories of leadership and how those theories of leadership relate to what's been done in the real world. As I say, the dissertation module goes on in the second year. Those modules in the second year are not lighter in terms of number of hours or in terms of academic rigor, but I tell you, some of the financing healthcare and economic stuff in the first year can be fairly heavy going, so it does balance out quite well, and also you get more used to what you're doing. So I think it balances out well having that dissertation in the second year. We would expect, or what is written there, that it's about 20 hours per week during term time, about 20-25% of that engaging with online content, and the rest of the time with independent study, completion of assignments. That means this course is very flexible and is very very adaptable to the way that the work that you have in your day-to-day job. It is, as all MSc courses, directed a lot by the individual, by the person doing the MSc, because it's about exploring the knowledge that you want to, that you find interesting, that you find that will benefit you. And everyone will bring some of their own IP to the course, so that some people might be experts in health and society and be able to really expand from a very strong background in that level. They might know nothing about economics and might just be able to understand the rudimentaries of economics in that level. So some modules will be harder, some easier, and it will vary a little bit. But that's the kind of expectations that are written into an MSc course. That's fairly standard, I think, around the country. We like to hope that when we got before COVID, we had teaching blocks, which were 2 weeks, one module for one teaching block, one module for the other teaching block, 10 weeks to write an essay, very rigid. And it was nice meeting people, and it was nice having live lectures, and it was nice doing what we did. But actually, there are limits on the number of on what you can do. And there was very much a lecture listening type of environment for learning. So I hope when we made the decision not so long before COVID to develop more of our content online, and then were forced to do it very quickly when COVID came along, I hope that what we've now done is made a very interactive learning environment. We have, during each of the 8 modules, 4 to 6 weekly live sessions. There are weekly office hours to work through different problems in the course and in the coursework that you've got. There are 2 workshops each year of 3 days where we look at, it's usually a day for one module, a day for another module, and a day either in the dissertation or in looking at skills that are needed or research. There are various activities, quizzes, group assignments, which really have had a good effect on everyone doing the course. And we have dissertation and research skills boot camps for those who need a bit of a top up for their dissertation. So there's plenty of different ways of learning, I hope. I guess that what we've tried to do is try to vary it with readings, asynchronous discussions, podcasts, webinars, introducing key concepts in these explanatory videos, mini lectures and podcasts in between each of these assignments. There are a number of reading lists which are easy to access and get to, and if they're not, they should be, but I'm sure they are. And we have a really good cohort of teaching fellows who are there to help, assist, make sure everyone is on board and going the right direction, but also to hang together the threads between each of the weeks, between each of the modules. So it provides a very joined up approach. There's a personal tutor for everyone, and there are a number of study skills courses at Imperial which might be useful, and many have found really important to their learning journey. Each of the modules then, overall, this slide should have been before what I just said, but overall, I always see them as there's 3 really important elements that go into it. There is a theoretical background to the module, and in each week there's theory on each of the different themes within that week. There are then a number of case examples from the real world, from people that have done health policy design, implementation, or even been on the end of health policy. These case examples will help bring to life that theory. The idea being, what you would do is learn and understand the theories, listen to the case examples, and then really understand what worked and what didn't from the theory, because it's not always quite as rosy as we put in the academic text, obviously. And there are then practical elements, as I've been saying, throughout the course, which are designed to be able to make sure that you understand the theory and the case examples, but not only understand it, but are able to utilize the knowledge in designing your own theories, opinions, arguments, case examples, and those assignments at the end utilize those practical elements and the theory to try and design something very useful. And as I say, try and make them as authentic as possible, so you will be able to use those skills throughout your day-to-day life. This is this is what we run on. We run on Blackboard. This is the Measuring Improving Performance in Healthcare. This is the wonderful Eric Mayer, who is one of the course co-directors, and he runs the Measuring Improving Performance in Healthcare. This is him on an introductory video where we basically introduce all of the concepts. You'll get all of the unit descriptions and outcomes, and the live sessions are advertised very clearly throughout the module. Joining those live sessions, they should help to hang everything together. There is information about the course contributors, and this will be unit 3, so this will be week 3, and these are the different lessons on each of those things, and we look at the takeaways and reflections to take to the next week. Gosh, the assessments, as I said, there's a diverse set of assessments to try and get away from everybody writing the essay. Just as there are a diverse set of ways for people to learn during our course. We do use reflective improvement journals, which comes very easily to some and doesn't come quite so easily to others, but is useful to all, we think. Presentations, essays, reports, simulations of different healthcare scenarios, and economic calculations, and all these sorts of things. All these are utilised in the assessment process. And the research dissertation, there's no getting away from it, is 10,000 words of something you'll be very, very proud of by the end, even if you sweat a lot whilst doing it. I guess I have had, just as I was looking at this talk that was beautifully put together by Jason, I did think there are 2 questions that I invariably get asked that I stuck on the end, and it's kind of why the Imperial course? Why aren't I going off to LSE or Birmingham or any of the other brilliant courses that are around the world? And I think that in general, you know, the foundations for health policy are going to be pretty much the same. They are going to be, I just realized I've been blurred for the whole conversation. Sorry. In general, the principles of health policy may well be the same. I think that we can add at Imperial some absolutely brilliant researchers who work for Imperial, who are thought leaders on the whole subjects of all of these different aspects of health policy, and they add a tremendous amount, whether that'll be Paul Aylin talking about the measuring improving performance, some of the key economic voices around the world, some of the people who are key in innovation, such as Lord Darcy and the other, and everyone, and David Nabarro, who runs the Health and Society module, who's obviously a director of WHO. So some brilliant researchers, but also brilliant people who've done it. There's one thing that the Centre for Health Policy is brilliant at doing, and that is joining together brilliant leaders from around the NHS and around the world who have done the job in terms of designing and implementing and making sure policy works, and they've suffered the scars to prove it, and also the successes to prove it as well. And some of those will come and talk, and many of those come and talk on the course, and you can see how they've done it, and you can see how the research underpins what they've done in many of their cases. But I think what else is lovely, is brilliant about this course, is about the people that we have on it. So we do not have a group of people who are all the same. We have a cohort of international students who come to join a cohort of UK students who have experience within the NHS, so we can all learn from each other. We have a cohort from the Department of Health, NHS England, from hospitals and healthcare institutions, management structures. We have clinicians, doctors, nurses, dentists, physiotherapists, probably many others that I can't think of right now. And we have a number from pharma who are sponsored from their industries. We have a number of people who are from innovative companies, and that group together makes an amazing conversation. Our lecturers tell us that you to be are the most challenging rooms that they ever lecture, because of the questions that they get. Most challenging and the most rewarding to lecture, because of the questions that they get and the discussions that you have afterwards. And so that's, I think, the top 3 reasons why you should come and join Imperial. And I always get asked the boring one, which is, can I come and join you? Well, so I'll be very clear. It's a 2-1 honours degree or equivalent around the world. But if you haven't got a 2-1 honours degree or equivalent, you can still apply. So there are some people who have a degree, but it's not on the Imperial Board of Honours Degrees. Examples are accountancy, and people in Australia sometimes aren't on the board. They may have come first in the entire country, but it's still not on the board, so they need to have a special case. If you have not a 2-1, or you have no degree, then if you have the relevant healthcare experience, we can still put you forward for it, either with a special case, which I can write for you after interview, or with a special qualifying exam, which some people do, which is something that we will do if people have lots of healthcare experience and desperately want to do the MSc. It is possible to do. We do look for 2 years healthcare experience. That's really so that we don't, so that we get people who can add something to our course. What is healthcare experience, I hear you ask, and it is quite a broad brush. So if you want to know, just if you have questions, just ask us. The English language proficiency is a prerequisite of the Imperial, so that is something that we must do. There are obviously further information all over the Imperial website, and that email down the bottom, health.policy@imperial.ac.uk, is your hotline to Melanie, because she is the woman that answers everything. And that's all I was going to say. I think I saw Lawrence joining, and if I'm not mistaken, I think he is going to enlighten us with some of his experience from the first year, but I may be wrong.
Hi, Colin.
Hi.
Good to see you. Thanks so much. Yeah, thank you for the invitation, and also to Jason and Melanie. It's great to be here. Thank you.
So, Jason, is Lawrence tasked with doing anything?
Tasked with answering questions, but I think just for context, Lawrence, I thought if you just would like to introduce yourself to everyone, just give a very, a quick high level 1 or 2 minutes of just your particular background and why you joined the program, and then I think if you're just here to answer any questions people may have, which are directed towards the student experience, that'd be fantastic. So yes, over to you, Lawrence.
No, thank you so much. It'd be an absolute pleasure, and obviously hello to everyone on the call. So I'm actually year 1 on the health policy course and into module 2, so still quite fresh-faced to the experience. And I'm still smiling, so it's a good sign. But I have quite a unique background in the sense that, and particularly in terms of my interest in the course, I initially studied music and worked in the music industry for a few years. before getting involved in patient advocacy, and that's specifically related to my health condition, which is severe haemophilia, a rare disease. So since 2017, I've been, in terms of kind of my professional career, consulting specifically around patient education and engagement in the kind of global rare disease advocacy space. And I think for me, it was really about, oh, you're right there, Colin. I think it was really for me, in terms of the attraction of the course itself. I think I've, primarily been focused at sort of a individual and organizational level. So that kind of micro-meso level of engagement, in terms of activities and working with particular clients around patient activation campaigns, for instance. But I think for me, it was about how can I break down the walls or the doors to be more involved and engaged and influence decision making, particularly around treatment access. And I knew that I would need to really, I would need to go back into education, or at least support my own professional development and capacity building through a master's. And at least that's how I felt that for me it was going to be the best route. So I think for me the attraction there, certainly from a health policy perspective, was about giving me that grounding to again go in and kind of employ those kind of skill sets at a system level. So as I said, we're only into module 2, but certainly it's been a real it's been a real roller coaster ride so far, but a good one. And I think kind of catching on from when I joined the call and hearing what Colin was sharing, I think particularly constantly coming back to the idea of real world application. And it's quite remarkable actually, even being only in module 2, to see already that being realized. And take for instance thinking about module 1, where we're looking at health systems and policy, that already already being able to kind of employ, particularly from a sort of critical appraisal aspect within my own work. And that's certainly a skill set that actually through the course so far I've already been able to develop. So I think it's already great to be able to link what we're learning in the course again to that sort of everyday professional work and practice.
Fantastic. Thank you, Lawrence. That's great. Colin, I think from now, unless you had anything else to add, we can move on to general questions. And myself, Mel, Colin, and Lawrence are here and can field questions. And so really, we can do it one of 2 ways. If you prefer to raise your hand, we can unmute you and you can ask your question, or should you prefer to post in the chat, please do. I'll give you a few moments to gather your thoughts.
Ellie's raised her hand.
There we go. Okay, Ellie, would you like to ask your question?
Hi, thank you so much. My question is for Lawrence, if that's okay, Lawrence. That was a really great, engaging sell, I have to say. It sounds great.
They're not, Ellie, I promise they're not paying me. So that was genuine.
My question is around how you think the kind of 20 hours a week study, how do you find that in with your kind of other commitments and, dare I say, social life and outside of kind of work activities, how you think, how easy that is to manage, and if that's something you found quite challenging?
Yeah, and I think it's a really good question, Ellie. And I think my first point to that is, I think it's great that you're online right now learning about the course, because I think I actually applied this time last year. So I gave myself essentially what ended up being a 9-month lead-in time, obviously having to go through the application process and then the interview, and then obviously being accepted, and sort of really preparing myself. Fantastic. So yeah, so I think that, so as I say, I think in terms of actually thinking about applying, I think it's a great time. But I think, I guess one way I probably think about it, I don't have children, but all my best mates that I speak to, you know, they all say you're never ready. And I think it is one of those things that you can always question it, right? Because I was doing that the same, particularly with the consultancy, you know, and obviously that takes up a lot of time, kind of running your own gig. And, you know, I constantly questioned whether I was going to be ready for it. But to be honest, you have to throw yourself in at the deep end, or at least from my perspective. I think, you know, if you're, you know, if it's something that you feel that is really going to support you, your own professional development and your career opportunities, then I think it's totally, you know, it's totally worth throwing yourself into that experience. And I think, like anything, you make of it, you know, what's the phrase, you know, you get out what you put in, essentially.
Yeah.
And I think that's something already with it, by again, like I said, by module 2, like we are now. I think that's something that I think everybody can appreciate who's on the course. Because obviously, I appreciate that it is very rigorous. You know, there is quite a lot of content, and I think it's just a case of learning about what, you know, what you consume, you know, what particular parts of the content materials apply more to yourself, and actually what you find of interest. And again, then thinking about also kind of the assessment side of things, and about what's going to be more applicable for the assessments, and then sort of combining the two. But I think certainly what I would say is that along with 2 other peers, so I'm a student rep, and you know, the course team have you know, are really transparent. You know, there's lots of constant communication. They're always open to ideas and suggestions. So I think it's really around that dialogue that has been super important to support people, and settle some nerves, you know, again, particularly around the assessment times, and obviously how they're managing that with their own workload, and obviously what's going on in their own personal lives. But I think there's a lot of support that is provided through Imperial. So yeah, I hope that answers your question.
Brilliant. Thank you very much.
No worries.
Veena, we have your hand up, so feel free to ask your question.
I was just going to add to that one little thing, which I think Lawrence did very nicely. You can choose which bits are really important to you and your bit of what you need to learn, and what interests you, and less so the others. We do try and highlight what is mandatory, what is like core learning, and where you can go off at a tangent, and other things that are more accompanying reading. And I think that helps with this 20 hours. It's not a rigorous 20 hours, and it can be flexed backwards and forwards, and hopefully well supported. But thank you, Lawrence. Sorry, I interrupted you.
Yeah, hi, this is Dr. Veena from India. I work in the government sector as a Taluk Health Officer, and I have an experience of around 20 years. Is that a setback?
No, of course it's not. That was the easy answer.
Yeah, because I heard you people saying it's you need 2 years of experience. So me, I have reached 20 years of experience, and
it should say up from 2 years. 2 years and over of experience. The more experience, the better. The course has seen people with the minimum experience, and even though they've had 2 years experience, maybe they haven't been deeply embroiled in it, and it seems some really experienced researchers and health policy makers and clinicians and all of this sort of thing, and you'd be really welcome, and your views on everything would be really interesting, I'm absolutely sure. I guess I can't see other hands up, so I'm going to carry on talking here, which is just to answer a question that might be on some of your mind, which is that all of you will have done something different at university, and all of you will be working in different aspects, and some of you will have done some very highly academic subjects at not highly academic, but highly analytical subjects is what I'm trying to say, at university, and find reading through papers and research second nature. Some of you will have done more economic backgrounds and will find, you know, the economic side very easy, but very difficult looking at anything outside of that. Some of you will have done history and English at university and be brilliant at writing essays and have never done a statistical analysis in your entire life. Our job is to try and make the course to be able to get everyone up to the pass mark standard, to be able to do those elements of understanding the research and reporting on the research and writing academic findings up to a decent study. It is applicable for all, depending on what, it doesn't matter what you've done before. Everyone comes to the course with their own special skills, and that you will utilize them, whether that be in writing, essay writing, formulating problems and policies, or whether it's your own experience of being clinician on the ground, or whether it's your experience in economics or policy making. They're all useful during the course, and our job is to make sure everyone learns to the standard that we require at the end. And so, no, it's not going to be in any way a disadvantage having 20 years experience. In fact, it's going to be really useful for all of those discussions. You're going to give the real world viewpoint every time, I should imagine.
Just one more question. My undergraduate teaching was in English, but still, do I have to take up IELTS or TOEFL to meet the English proficiency requirement?
With that, actually, I can answer that because that will come through the admissions team. I say I can answer that, but what I will say is the admission, as Colin said, the English language requirement is an admissions department decision. So there are specific standards that if your undergraduate was not in the UK, that you would be required to pass the language component. I would guess it wouldn't be any problem for you to pass it, but you may be required to do that, even if we've had in the past NHS doctors who live and work in the UK and clearly have absolutely no issue with their English language, but because of where they studied, they're being asked to provide it. So it's one of those small hurdles to jump, unfortunately, depending on your educational background, but provided that you know you're have a good standard of English, it shouldn't be difficult to meet the requirements. You know.
So in that case, I think I should plan for IELTS. I mean, that would be a better idea.
I would guess so. Yeah, I would. It's one of those things that comes through from the postgraduate admissions team, I believe, when you have applied. So it would be, you can be offered a place with conditions, and one of the conditions would be to pass the English language requirement. And there's a number of different ways that that's tested. Our colleague Molly, whose email address is in the chat there, Jason's added it in, and we can send it to you all as well. She's a specialist in looking after admissions. She looks after admissions for our whole department. So as I said, I look after students once they're on the course, and I know a little about the admissions process, but Molly is really the expert. So if you've got specific concerns or worries about any of that process, she can definitely help with those as well. We can help to put you in touch with her.
Okay, thank you.
No problem.
And lastly, just one more question, if people don't mind. As you said, are we assessed on the basis of credits? Is it the same system which works here also? It's a course credit.
Do you mean in terms of your application, or do you mean in terms of the assessments
the study,
within...
the program as a whole?
Mm-hmm.
So once we enter the program, is it the assessment which has the credit system? Like every subject, it has a number of credits to its portion, and we have to finish those credits. I mean, does it work like that?
It does, yeah. It's a technicality though. So you'll have, as Colin said, if you're doing the full masters, you would have 8 modules which are each have a credit value, an ECTS value, and then the dissertation has its own ECTS value, and adding all of those together gives you enough credits to get the award. And obviously if you were to sign up for the postgraduate certificate or the diploma, there's different totals that would add up to give you that award. So it's not that you earn a different number of credits based on your grade. It's you either pass or fail a module. Generally everybody passes, and you are then awarded that number of credits. So I'm not sure if that's quite what you mean, but hopefully that answers that question.
Okay, yeah, thank you.
No problem. So there's a question in the chat I'm happy to read out as I'm off mute, from James, saying which days or times do the interactive and live elements of the course run, and if we miss those due to work commitments, are there recordings of these sessions? So again, I'm happy to answer that if nobody minds. We have gone through the last couple of years of running live sessions for students, and we tried lots of times sort of polling everybody to find the ideal time, and of course what we realized is there's no perfect time for everyone. So what we do now is we set a day and time for your cohort group. So the live sessions are either a Tuesday or a Wednesday currently at 4 p.m. So Lawrence, remind me, your session is on a Tuesday, isn't it? No, a Wednesday.
Wednesday, yeah.
See, I have to
4
check
till
it.
6.
Whereas the year 2 students are on a Tuesday, so they're meeting now, in fact. Those sessions are recorded. I mean, obviously you will get more out of them if you can join them live, because there's the element of discussion and interaction and engagement with your peers, which otherwise you will just get when you're on campus, or you'll mainly get when you're on campus. And also just to say about the on-campus days, we've briefly touched on those, but if you were also asking about those are in person. You're required to be there for those. So the way it works at the moment is we have 2 occasions each academic year of 3 days. It may be that in future there might be some change to that, but at the moment it's 3 days, consecutive days, twice a year, when you would come onto campus and engage with the rest of the cohort and the module leads, and those are an essential part of the course. So they're not. It's not something that you can dial into. If you were asking about that as well. Anything else? Any other questions or things that we know that people often ask that we can try to answer while we're here in the last few minutes? We do quite often find that people think of questions afterwards, so we will follow up with everyone who's registered for this session as well, and send contact emails so that you know who to get in touch with if you've got questions. So if you haven't got something you think of now, but it comes to you later, you'll be able to get in touch with us to ask.
Yeah, I think absolutely. Mel, if we have no further questions, I think we can safely thank everybody for attending and for their time. And thanks also to Lawrence for joining, and Mel will be certainly sending out a follow-up in due course. And nice to have met you all. We hope to receive your applications soon, or do get in touch with questions. So we will close there.
Thank you very much, everyone.